This is a silicone locking liner. It has a fabric covering. Usually there's a shuttle pin at the bottom, and on the inside it's made out of a silicone material that sometimes is thicker at the bottom. Some liner manufacturers put more silicone in the front, but in either case it primarily performs two purposes. Its two main functions are to protect the limb and the bony prominences on the leg from trauma. So it's like an extra skin, but it's thick skin, and it's pretty durable skin. The second purpose of the silicone locking liner is to hold the prosthesis to the amputee. It's a suspension method. It's what holds it on. So we're going to talk a little bit today about how to properly don or put on the silicone locking liner. I have seen several patients who intuitively try to put it on like they do a sock. So I will show you what I mean by that. So they'll pull it on just like they would a sock on their shoe. The problem with that is the skin and the silicone are sticky, and that's by design. But it makes it very difficult to pull on the liner and to do so properly. All right. Another method I have seen is where patients roll the liner up like a donut. Okay, just like so. Keep rolling it until they get it all the way to about here. Then they put it on the limb, and then they roll it up just like so, which seems like it would work just fine. The problem is it's very difficult to eliminate air voids in the bottom. So what we have here is a lot of movement because it's not a second skin. It's like loose skin. And we don't want the air void in there because there's movement, and movement causes friction. That can lead to blisters and other skin problems. It causes some problems when you're walking in terms of balance. So it's just not an ideal way to go about doing it. The proper way to put the liner on, and it always goes on and comes off the same way, is to turn the liner inside out, just like so. Now notice if I let go of that, it'll slowly go back to a concave shape. Put your leg out. We don't want to put the liner on the limb with that air void in there. Remember, we don't want any air between the skin and the liner. We turn the liner inside out completely by slowly working the bottom up until we have more or less a flat surface. Once you have it almost like you're going to eat a hamburger, that sort of hand position, reverse your hand position and place it on the end of your limb and slowly roll it up. And I'm going to have our patient here demonstrate that. So he's placing it flat against the bottom of his skin. He's slowly rolling it up. No wrinkles. And now we have a very secure connection with his body. So that's going to make a big difference when he's starting to try to walk with his prosthesis. The next thing, once you get to this point and you have your liner rolled all the way up, just like so. And that is a properly donned liner. The next thing I want to talk about is this little pin right here. That pin is designed to fit into a lock. This lock is actually going to be inside the prosthesis permanently in the bottom. You only see it if you look inside the prosthesis and see this lock with a little hole right in the center. Now most locks have a concave shape, and that's to make sure that if you are off a little bit on your pin alignment, it has a tendency to drag the pin towards the center of the hole so that we get good engagement of the lock. It is a ratchet style system, so as you push in, you'll get numerous clicks, one at a time after the other, until the prosthesis is completely donned, and then the clicks will stop. To take the prosthesis off, there's a release button that oftentimes protrudes from the prosthetic socket. In most cases, we put it on the inside of the leg, but in some cases we put it on the outside leg or whatever, just to keep people from bumping it, motorcycle riders, people that ride horses. Sometimes we recess the pin. But in any case, all you do when you want to take the prosthesis off is depress that release mechanism and pull the prosthesis off, and there you go. When you want to put it back on, it's the reverse. Put the prosthesis on, pin engages in the lock, and away you go.